Hormones have been front of mind for me long before they were a buzzword. I have written pieces about the day my mother died. She is physically alive and well today. She's my best girlfriend, but that woman who I was raised with for 18 years, that was it, hard stop. I'm constantly, for a long time, I have been putting pieces together of like, how does this relate? How does this fit in? And then you get into the world of that functional and integrative space where you're looking at the root cause of things. And hormones are root cause. They are what make our body go, not go, up-regulate, down-regulate, all of that.
Right.
There are some other things that can contribute, right? Gut biomes, and there are other things too, but hormones are huge. And so I have just been kind of marinating in how can I make this something that I share with the world? How can this be one of the gifts, a legacy that I leave?
All right. We're so excited to have you. This is Emily Gaeta, and you own La Sweet Spot here in Denver, Colorado.
I sure do.
Yeah, thank you for joining us today. I'm Lindsay Harris.
And I'm Kristen Abel.
And Emily Gaeta. I'm a board-certified family nurse practitioner. I own the Sweet Spot here in Denver, and I specialize in everything your gynecologist can't or won't do for you. So that's everything on the spectrum from hormone replacement therapy, alternative modalities to deal with sexual dysfunction, sexual wellness. I do a lot with bladder issues like interstitial cystitis, overactive bladder, all of that good stuff, peptides, medical weight loss.
Wow, that's awesome. So how did you get into this?
I've been into it for a long time. This started for me the first time a hormone dysfunction was written on my medical chart. I was 16 years old.
Wow.
So this is a passion project that's a long time coming. I've been suffering from PMDD for all of my, fertile life.
What is PMDD for those who don't know, including myself?
Premenstrual dysphoric disorder.
Okay.
So think PMS on steroids. It is life-altering. It is complete chaos. It is hell for 7 to 10 days before your cycle. And
so it can happen to teenagers.
It sure can.
And that's how you found out.
It sure did.
Oh.
And it's been devastating. I've lost friends. I've lost jobs. I, manage things much differently now, of course. But when all of this was coming to light, people didn't know how to make sense of it at all. And still don't. The research about PMDD is pathetic at best, in line with many other women's health topics.
Right. And so when you were a teenager, though, there was even less information. So how long did it take you to figure out some sort of solution?
I'm still working on it. And it's a big drive behind why I started my own practice. I am a little bit of a scientific guinea pig. And, there are a lot of assumptions, a lot of maybe this could help. Maybe this could help. And if there is even 5% chance, I'm trying it. I have yet to find something that really works well.
So is that what, I guess, was the drive behind becoming a nurse practitioner?
Totally. My dad is a nurse, and became a nurse at the age of 50.
Wow.
So inspiring.
Yeah.
We would always visit nursing homes. I grew up just learning how to be a helper and a caretaker, and, thought maybe I should, you can combine that and make a career out of it. In the same line of hormones, my mother had premenopausal uterine cancer, which is incredibly rare if you look at her demographic. Caucasian woman, not overweight, not a smoker, all of these things, a real anomaly. And that would have been 2002. So just after the WHI was released.
Right.
And it was life-altering to watch my mother go through surgical menopause without the help of hormones.
So what age was she when this happened to her?
49.
Okay.
Yeah.
Wow.
And
Was this happening then at the same time that you were having the symptoms when you were 16?
yeah. So I
Oh,
that
wow.
started when I was 16. I
Yeah.
found out on my 18th birthday, we got the pathology report back. So we were at the dinner table at my favorite restaurant.
The pathology report for your mother.
Mhm.
Okay, so back up a little bit. Tell me exactly what it was that your mother was diagnosed with.
Uterine cancer.
Uterine cancer.
Mhm.
And because of her treatment, she went through menopause early.
Correct.
Without any hormone.
Correct.
Replacement.
Yeah.
And like this is a whole nother conversation, but part of the struggle for women because of the study and even information currently that if a woman has gone through cancer, then so many doctors are like, absolutely not. This is not for you. This is dangerous and harmful. Hormone replacement. I think there's a couple different schools of thought. And really what I'm learning is a lot of the really great doctors give all the information to the client and let them make the best decision for themselves.
And she was offered SSRIs, but as a woman who was previously life of the party, did not associate with low mood, depression, anxiety. I mean, my mom is the coolest cat on, that side of the Mississippi. She's in Baltimore.
Yeah.
She's like, there was just a horrific gap in the information that was given to her about what to expect from, you enter this operating room
Right.
with everything
Mhm.
and you're leaving
With
Nothing.
nothing.
with nothing.
And that, that is a lot of women that I've spoken to, SSRIs are like the first.
Line of defense.
Yes.
Yeah.
It's like, that's what they push first. Now there's so much more information, but even still, we're in that phase of our life. So we're kind of invested in it. But I've noticed that women, when they're completely turned off to this information, not turned off, but their brain isn't registering that this is valid, important information. And until they hit the skids, then they're like, oh, okay, what do I do? But there's not a preventative care going on in education.
It's wild.
Mhm.
It's why, information like what you guys are doing is so important.
Well,
for-
I'm trying to get all of my friends that are in their 30s and early 40s to start listening and educating. But to Lindsay's point, like until shit kind of hits the fan, women don't realize that they need to take great care and take the extra time because nobody's going to help you, sadly, in this
Right.
phase of life unless you can help yourself. So that's what I'm most passionate about because I had no knowledge and then was just thrown it into the deep end, barely made it out of the deep end. But because I did so much of my own homework, which is how we got connected. Yeah. And she presented at a meeting at my office and I was like, oh my gosh, one, you're just such an incredible speaker, but also she just knows everything about
Right.
the topic.
Right.
And I was so upset you wouldn't have known, but I was like, dang it, I wish I'd have met her a year ago because I was already so far down my own journey.
Yeah.
But then you've been able to help so many of my women friends in midlife that didn't know what was wrong with them. And they're all honestly back to themselves, within months of what you've been able to help them with, which is all different things. One size, as you know, does not fit all. And it's been so cool to see my friends that I was just, having coffee and crying and doing all the things. And then I see them the next time and they're just back to normal, like the girl that I knew in my 20s. So that's been really cool to be able to see how quickly, if women are given the right care, can feel like themselves again. Because you listen and you know what you're talking about.
Yeah,
So,
exactly. And every woman is different. Like Kristen, I'm older than Kristen and Kristen struggled more than I did,
earlier than you did.
earlier, and I was thinking I'm fine. And then I wasn't fine 9 months later. But the thing that's been most mind blowing to me is reading how estrogen affects the whole body and the brain. And we have so many receptors, and how, thinking back now after I've read so many books, it was like, I know I always had a horrible PMS, so horrible. And I've said this multiple times on a couple podcasts, but like whoever I was dating would set an alarm for the week before my period to disregard anything that was coming out of my mouth. And I've heard of tell me, PMDD. Okay, I've heard of that. And, I thought back to when I was younger and was really struggling. I did have one doctor suggest that maybe taking progesterone during that time might ease some of the symptoms. And I was like, whatever, because I didn't have a knowledge of what was actually happening in my body. You just don't think about really hormones unless you're maybe having miscarriages or trying to go through fertility treatments. And speaking of miscarriages, I had like 6 because my body wasn't producing progesterone. And once I went to a specialist who said, just take this, then I had 2 successful pregnancies. But women are just like, you think that everything's going to be normal. Yeah, everything's going to work. So tell us, I really want to go back to, I understand your mother's experience and how that was just like another thing that probably, inspired you to do this, but back to your own, which you're still is a work in progress, it sounds like. Tell us like why, like how you got started, like what was, you were working as a nurse practitioner, probably for someone else. And then when did you pivot into your own business?
So this has been on my mind for a long time. The traditional space just did not align with me very well, even though that's my training. And that's, as a nurse, that's how I was brought up in the medical world. It was 2017 and I started doing some integrative and functional work that was new to me. I mean, I was East Coast and things travel from west to east as far as the latest and greatest. And when I came to Colorado is when it was like, oh, right. And it gets things and you have these experiences that have been imprinted on you. Hormones have been front of mind for me long before they were a buzzword. I have written pieces about the day my mother died. She is physically alive and well today. She's my best girlfriend. But right, that woman who I was raised with for 18 years, that was it. Hard stop. So I'm constantly, for a long time, I have been putting pieces together of like, how does this relate? How does this fit in? What role and then you get into the world of that functional and integrative space where you're looking at the root cause of things. And hormones are root cause. They are what make our body go, not go, up regulate, down regulate, all of that.
Right.
There are some other things that can contribute, right? Gut biomes, and there are other things too, but hormones are huge. And so I have just been kind of marinating in how can I make this something that I share with the world? How can this be one of the gifts, a legacy that I leave?
Did you find resistance in like the regular practice of medicine when you were not on your own and could do what you wanted? Like, I don't know who you worked for or how that worked, but a lot of doctors are against some of these protocols.
Yes, we never even got to these conversations.
Okay.
Right. I mean, this was, you had 15 minutes and you had 30 patients on your panel and you're not getting here. You actually are,
there's not enough time.
You are administering sick care. So if there is something that is grossly wrong or a lab value that is really off target, you're going to make a judgment call on a prescription or something like that. But there was no time. There was certainly no time. And it's something I hold very sacred in my practice because successful hormone work is nuanced. It is patient specific. We have these algorithms in traditional medicine. Okay, Mrs. Smith has a UTI. Is it complicated? Is it uncomplicated? Okay, it's uncomplicated. Is she pregnant? Is she not pregnant? Boom. This is the medication that works for 99.9% of people. Send her home with it. Call it in. See you later, Mrs. Smith. Hormones do not work that way.
And they're not even recognized in a blood panel. They're all over the map. So you kind of have to start with something, treating symptoms. And then I've noticed with myself, my blood work looked normal. Well, the testosterone was next to nothing in the progesterone, but estrogen looked okay, but my symptoms were telling otherwise.
Mm-hmm.
So then you treat it, and then you can kind of see how the medication is working. Then it's like, okay, the testosterone's at a normal level. Here, the progesterone is up. And so it's like an imperfect science, but you have to go by the symptoms of a woman, and it's trial and error.
That makes people in traditional medicine really uncomfortable. We are not.
So you've been
way.
treating the symptoms since you started your practice?
Mm-hmm.
Yeah, because that was kind of unheard of back in 2017.
Mm-hmm.
So is that when you started the sweet spot?
I've been open just over a year on my own.
Oh, wow.
Okay. So you were doing this before, but not on your own.
Okay. Exactly. And my best girlfriend in Baltimore, she is an incredibly successful OB-GYN practice, decades old. And she herself, she went down this path a little bit before I did. We would have these conversations where she, is like, this is life-changing.
Yeah.
I feel like maybe things weren't being done the best way. Right. And she is just an unbelievable mentor to me. She is phenomenal. She is wickedly smart, and really cares. And it's just so telling how, ingrained our teachings are, and how we were brought up into medicine. And it's hard to go against that.
Right.
There is a rub there of like, oh,
yeah,
I don't know. But, for those of us who are brave enough to take the leap and to actually practice according to research, and, it becomes very easy.
Yeah.
For me, it did, where it was like, oh, this is what healthcare is supposed to be.
Mm-hmm.
Right. And we interviewed a hormone doctor in Austin, and, he was in an OB-GYN practice, and he was like the new guy, the young guy. So he didn't have a patient load. But he went to a seminar and learned about hormone replacement in the early days. And he was like, nobody taught me this in medical school, but the person, I can't remember the guy's name that was giving the ceremony, what do you call it?
Not the sermon.
Here's my brain. The seminar.
Lecture seminar.
Yes, yeah. The lecture. He had written several books, but this doctor went back into the research, and it was all there. It just wasn't taught. Like somebody had done the research. So it was readily available. Did you find that when you started digging in? Like,
it's wild. It's overwhelming when you compare what you can read with your own eyes. And to his point, I mean, I was taught how to help someone get pregnant or how to prevent them from getting pregnant. Got it. Hormones past that. What hormones?
Yeah.
Right.
You don't only the next anymore. 70 years of your life, potentially.
And we're outliving our ovaries by 40, 50, 60 years in some cases. I have patients in my practice who have been having hot flashes, debilitating hot flashes. I'm recalling, I guess she's 73. She has been having them for 30 years.
Wow.
And no one will help her. She is not on blood pressure medication. She is not on statins. She is healthy as a clam. She's a non-smoker. She's not overweight. What are we doing?
So she's never had estrogen her whole life? She's just been dealing? Oh my gosh.
She had kind of, because women are, we grin and bear a lot, right?
We do.
Yeah, of course.
And so, directly after menopause, she was told, like, this is how it goes. This is what happens. Not, you should seek treatment for that.
Right.
You don't have to live
Right.
that way. And by the time she started asking about it, she was getting you're greater than 10
You're
years
too
out.
old. Yeah.
Right. And I hear a lot of women say that, well, it's too late for me. And they're 60. And I'm like, it's not too late.
It's not too late. And the North American Menopause Society has a beautiful position statement about that exact topic.
You mean recently?
Yeah, it has to be pretty recent. I
Yeah.
would not know the exact
Yeah.
date.
Okay.
If I had to guess, it'd be 24, 25 that they
Yeah.
came out with this position statement about hormone replacement therapy over 65. And it needs to be a collaborative, critical thinking moment, that these hard stops are not how things should be being practiced.
Right.
Yeah. My mom was born in 1951, and she still has hot flashes. She's still on estrogen. And just in the last couple of months, she's like, my doctor is suggesting that, maybe I get off estrogen. So I was like digging for all these articles, trying to find like, do you really need to get off estrogen?
No, you
Yeah.
don't.
So I sent him to her and was like, there's no evidence that says you need to. If you're still having the symptoms and you don't want to deal with them, there's no reason to get off estrogen.
Is she
In
still
your
having the symptoms on the estrogen?
No, I think it's if she gets off of it.
Okay.
I think she feels good when she's on
Great.
it. Yeah.
Right.
But they were suggesting that maybe you're getting too old, you need to go off. And I'm like, why would you go off now?
right.
You feel good. You're in your 70s. Like,
Protect
your
bones.
bones and your
Protect
brain
your
and everything.
heart.
Yeah. So,
I know it's wild. My mom thought hormones replacement was bad news, and everybody was doing it until the study came out. And I do have an aunt that took, I guess it's Premarin, and she said she had migraines, horrible migraines for 10 years, and then realized the dose was too high. So she lowered the dose. They went away. She was one of the lucky ones that just stayed on estrogen the whole time, ignored the study because she felt so bad without it. And she's strong as an ox. She's 82 now. But she had a hysterectomy. All the women in my family had hysterectomies. So it was really, I didn't have a good understanding of where I would be in that range. Not that it always maps out exactly like the women in your family, but I did read that the average age is 47. And that's exactly when it hit me.
Interesting.
Mm-hmm. But, tell us more about, so you do hormone replacement. I really want people listening to understand your business, because this is about you and your business and getting the word out, especially here in Denver. Lots of people need these services. So besides hormone replacement, what are you up to?
Oh, I have the coolest job. I have the coolest job. So some other parts of my practice that are very helpful for people, I do medical weight loss.
Mm-hmm.
It is a robust program. It looks wildly different than if you get these medications online.
Mm-hmm.
I'm seeing these patients every 4 weeks. We are scanning their body composition every 4 weeks. My patients are gaining muscle.
Mm-hmm.
We are utilizing, peptides for lean mass along with, the semaglutides and the tirzepatides and all the things. So that's a really cool component of my practice. I also I work a lot with women who experience sexual dysfunction, and that ties in, of course, with HRT. We make sure that those things are in place, but I do a lot of, I like to say, we need to determine first if it's an electrical or a plumbing issue.
Right.
And then based off that, and sometimes it's both.
Right.
But based off of that, I do a lot of interesting things with peptides. There's nasal sprays, there's troches that can help with electrical issues. Recently, Addyi is now, approved for both pre and postmenopausal women. Huge.
Mm-hmm. It only took 6 years compared to the 6 months that it took Viagra to get passed. Yeah.
Not that we're counting.
Yeah. It's insane.
It's insane. And then I do a lot of work with exosomes and PRP, for plumbing issues if we need to, if the vaginal tissue has atrophied too much.
So is that the light treatment?
It
What
isn't.
what is PRP? Explain this.
Platelet-rich plasma.
Oh, yes. Okay.
So we draw a patient's own blood. I think it's really important I know that there are places that use PRP blindly. I'll use the word blindly for lack of a better word. But the product you get if you spin blood down into the platelet-rich plasma is only as good as the patient's,
Like health?
kind of.
Right.
So if I'm doing an O shot on a 67-year-old woman who's been without hormones for 20 years and, might have, maybe she has factor V Leiden, maybe she has other clotting disorders, we're going to talk about a different product to use for her procedure, and that looks more like an exosome.
Okay.
The O shot. You got to tell us about that. I don't know
so
anything,
curious.
but
And
I've heard about it.
yes, I want to know what the O shot is. I was listening to someone on Instagram talk about it, a doctor in Houston, but back up to the plasma. So does that only work with your own plasma?
So so it's
You have to
autologous.
inject your own plasma.
Correct.
Okay. You can't take like a 18-year-old's plasma.
Wouldn't that be nice? No, that would require quite a bit more screening.
Okay.
Of the blood and a traumatic
But
situation.
then how do you know if someone's a good candidate?
Well, so
for
you
that?
do a really in-depth medical history,
Okay.
right? I mean, you have to. I know of other places that offer this service that you can just show up and
that's
pay for
scary.
it and get it.
Right.
Well, I don't know how scary it is
okay.
because it's your own product.
Right.
It
You
just might
could
not
just
do
be
anything.
throwing money away.
Right.
Okay. So it's
And-
probably not going to do you harm. It just might not be
Correct.
beneficial.
Correct.
And it's expensive. So
It's expensive, and you want someone who really knows female anatomy to do it.
Yeah.
I've delivered a little over 2,000 babies as a labor nurse. And so I feel very confident in my ability to assess vaginas and know where I'm at and my landmarks.
So what is an O shot? Where is it injected?
So that's a great question. And honestly, it's an indication for more than just one medical issue. So wildly successful for mild to moderate stress urinary incontinence. And that's if you cough or sneeze, or, if you're someone who's crossing your legs every time you laugh, that's you. That's,
So the O shot works for that.
it really does.
Okay. But what does the O shot stand for?
O shot. It's a trademark name. So I'm a
Okay.
certified O shot provider.
Okay.
You can call it something else and still perform the same procedure.
Okay.
But the original.
Does that stand? I assumed it was for orgasm.
It probably does.
Okay.
mean
I mean,
that.
I don't know,
Yeah.
but that's where my brain went.
Yes.
I was like, oh, just inject.
O shot.
Yeah. Okay.
Yes.
Okay.
I'm sure that's what the insinuation
Okay.
is, for sure.
So
So it's for sexual health,
So
or it's for a multitude of things.
so it's for many indications, right?
Wow.
So the woman who has stress urinary incontinence, great for her. The woman who wasn't given HRT and has vaginal atrophy or clitoral atrophy and wants to regenerate tissue,
Oh, so it can
Amazing.
actually help you regenerate.
100%.
So then how often do you have to get the shot?
So remember, no two patients of mine are the
Right.
same. My protocol is this. We do a procedure. We check in 3 months. If you have even had a remotely positive response, I repeat it in 3 months.
Okay.
So that would look like plumpness, rehydration,
Collagen, blood flow,
right.
nerve regeneration,
And how do you test all of that? Through the blood work or through
symptoms.
okay.
So, I just heard from a patient who, is texting my office line. You have text or call because I'm just so in touch with my patients. And I'm running on level 7 on the treadmill
Oh.
and I'm dry. Like, this is life-changing.
Oh, like because she was peeing her pants
Yes.
before.
Yes.
Yeah.
Wow. So that is, you
The
said
O shot, I didn't realize that's what it was for. So it can
It's
help
for
for so many
things,
things.
right? So
Okay.
the stress urinary incontinence, and then, anorgasmia, like women who have,
Right.
either have perceptions of pain with clitoral touch. It can be very helpful. It just kind of recalibrates things
Mhm.
in the nerve endings. So people who have either never had orgasms
Right.
or who find that to be difficult. And then, of course, the woman who.
Well, that's great that you're not just telling them to have a glass of wine and get
we gotta
over
try
themselves.
Oh,
Because that's what everyone's been told for the last 100 years. So that's awesome. I didn't know it worked for all of those things.
it's a really cool procedure.
Okay, so in theory, like how long, let's just say for maybe the average patient, if you had it every 3 months, do you need to then continue that forever?
No. So if you have response, but not optimal response, I'll
Mhm.
repeat it in 3 months.
Okay.
This particular patient who is dry now and on
Mhm.
trampolines and treadmills, I did one procedure.
And so she might not need it for like years.
She might not. And I tell patients,
Mhm.
come talk
Yeah.
to me if things start to backslide. But the expectation I set is that you'll need a repeat every 12 to 18 months.
And you're saying stress, urinary incontinence. I always assume that if your bladder is leaking, you had, like I
You
know
need to
people
do
that have like
Kegels.
no, I've heard of people who have, multiple births that's, I have a friend with 5 children, and that was just an obvious symptom from having so many, having a litter. But this sounds like it was just like stress. It's almost like, is it like you said, the brain or the plumbing?
Well, it's all connected.
No. So
Is it a stress induced
No.
condition? Okay.
the condition is called, so there's 2 types: urge urinary incontinence and stress urinary
Okay.
incontinence.
So it treats both?
It doesn't
Oh.
do as well for urge.
Okay.
Urge is a transmission issue where the
Gotcha.
brain is sending signals to the bladder either too soon or too
Yes.
late or too frequent.
Mhm.
That's different. Many women, I'll go out on a limb, most women who are having incontinence secondary to childbirth
Mhm.
have stress urinary
Okay.
incontinence. The other
So the O shot works for the stress version.
Yeah. Okay. And, just the other thing is, do you do the light therapy or, okay. Because there's many things I've been
Wait, is
reading
that
about.
the one for the sexual health?
Yeah.
Oh, yeah, I've read about that.
Yeah.
That's really
It's
interesting.
very
You should add that to
interesting.
your lineup.
I have so many things
Yeah.
I need
Yeah.
to add to my lineup.
Yeah.
I can't wait.
But you already offer a lot.
Yeah,
Because
so
my
much.
friends that I've sent to you, like, you have not treated any one of them the same. Some is HRT, some is thyroid, some is GLP. Like, everybody's different, which I love. And they all are back to themselves very quickly. I mean, I know that's best case scenario, but I haven't had anyone that's gone that's like hasn't had an exceptional experience. So I just wish that I had met you 18 months ago.
Well, it sounds
But here
like,
we are.
It sounds like you're really listening, and, you can probably hit a lot of these things just by starting. I don't know, if you're not doing hormone replacement and you need hormones, that can fix a lot of things right off the bat. These other things to me seem like, okay, these are like the last, like, this is later in the game. Let's start these like hormone replacement, see where you're at. It's almost like a bonus, because just like with peptide therapy, I had to feel like myself again before I could even think about these other things. It's like beauty treatments, right? If you can't get out of bed, you can't really think about your beauty treatments.
Minor detail.
Yes.
Right? What do you mean I need to wash my face morning and night? And yeah. Exactly.
Yeah,
You
I'm
feel-
finally in that phase where like I feel back to normal so that then I can start talking about optimization
Mhm,
things. But like
Yes.
if somebody had told me to do these optimization things 6 months ago, I would have laughed in their face
Yes.
because like
You're like,
mentally I wasn't in the
you're
right
so-
place
hoping to brush your teeth every day.
Right.
Yeah.
or go
right.
to work or answer the phone or whatever.
And so many
Yeah.
women feel overwhelmed by this process. And, I just want to encourage women that women are amazing and strong and multitaskers, and they give so much to their families and children and pets and all the things, jobs. that they have, like, a big part of this is that they have to carve out time for themselves in order to figure this out. Because even though it's overwhelming, as soon as you feel like the life is breathed back into you, you do have motivation for other things. And it's like you cannot skip out on yourself. And that's been breathed into our culture. So that's probably one of the biggest places to start. They're not going to come here if they don't feel like it. But I think more women giving other women permission.
It's huge.
It is. We're very driven by that. It's like, we'll sit there and think about something. We know what's best for us. We know what the answers are, but we just sometimes need a little nudge that, like, hey, you can do this.
Well, I think you have been just an incredible driving force with that, and you have given a lot of women the permission to seek my care.
Yeah. Well, I love that because that's what I've been trying to do. It just happened. Like, I didn't go out to seek this in my life, but it kind of landed in my lap.
Sure.
And I felt that there was no other way but then to help people that are either about to be in this phase of life or that are in the trenches and like don't know where to go. So yeah, I just started just putting it out there, and the amount of people that call me, text me, email me, DM me of like, I can't even tell you, thank you for opening up. I've done this, this, and this, or I didn't know where to go. I haven't been myself for 5 years. Like, they're coming out of the woodworks, and that's just because I put myself out there.
You were brave enough to do it, and there's so much shame and stigma around it as a woman. And at this age in my life, I feel like I've finally become the person that I've always wanted to be. And then the wheels started falling off. So it's like, no. We can't do this. We can't let ourselves, we can't, we work so hard. My children are raised and out of the house now, and I have time to do the things that I really want to do. And Kristen being brave enough to talk about it made me feel like, well, maybe I could talk about it too. Or maybe I could try this and, it'll be okay.
Well, my first post on Instagram, I was like, oh, should I post it? But I really felt strongly like it was almost like a message from above. Like, you got to share the experience that you've been to now that you're not all the way on the other side, but feeling like a human again. And I sent her the draft and she's like, you have to post it. And I'm like, are you sure? Yes. And then she's like, yes. And I'm like, dang. So then I did. And then it
the floodgates open.
Yeah. Then it just was like, oh, I can't not share my story because it'll help so many other people. And just the amount of people that you and I have been able to help with like 4 Instagram posts because it reaches so many people, and it's not even like my quote unquote career, but most people that I'm close with are between 40 and 55. So it's like the amount of people, whether it's their mom or their aunt or their sister or themselves that they've been able to help is just like been life-changing for so many. So
it's so beautiful. I am so grateful for women like both of you. I'm trying to get a social media presence for my business. It's not something that comes naturally to me. What is interesting though is I had asked a couple of patients who had truly transformational back from the dead. Marriages were a wreck. Relationships with their children were a wreck. Jobs were falling apart. Really, the wheels falling off. And I heard everything from, I'm just not comfortable to do that. My husband's not comfortable with me doing that.
But they might do it anonymously.
They might. For me, it was just a really good barometer on how much more we have to go. Like, this was still something to be ashamed about. It was still something that maybe they felt like they're doing wrong.
Right. That kind of breaks my heart.
It's
but
awful. Yeah.
I feel like they'll come around.
Yeah.
And then even
But were you saying that they did come around?
No.
Okay.
No. And I was that is not a requirement, right, to be a patient of mine, but I'm desensitized to it because this has been my life for a very long time. Women's health, vaginas,
Right.
rectums. You couldn't impress me if you tried with your
Mhm.
vagina. I've just seen too many.
That's like
But-
us with the dirty house.
There
We've
you
seen
go.
it all. Yeah.
Can't impress me. And so I am desensitized.
Mhm.
And I think I was surprised at still how much just true fear and shame and
Mhm.
stigma, even in someone who has had a
Mhm.
life-changing experience.
Yeah, it's big. And if you look at what is it? The Viagra for women, what's it
The
called?
Addyi.
Pink pill.
The Addyi. Yes. So in reading about that, they really didn't want to approve it because they were afraid women were going to have car accidents if it made like really just thinking for a woman,
Completely.
really
Completely
just
ridiculous.
really just controlling a woman, right? And it's like that's what our society has done. They think and feel for us. And so for us to be okay with thinking and feeling for ourselves and making decisions, I can tell just by talking to you that you're very compassionate. This is what we need more of. And I was the one who went and got all my hormone replacement, and then I didn't take any of it. And I waited. I was like so scared. And I put it all in a basket underneath my kitchen or my bathroom cabinet. And then a year later, when I felt so bad, I was like, okay, it's time to maybe go back. So I didn't take it. I went back to the doctor, and he was so sweet and took an hour with me in his office and explained everything and really helped me understand that, because I'm one of these people that has to understand everything. He was like, if you take this and you don't like it, you can stop taking it.
It's a miracle.
And again, that was a permission, right?
Sure.
And so then I took it and I was like, oh my God, why did I wait so long? So
And I'd been telling her, I'm like, you should try it. It's amazing. And she's like, but I'm not, everything's fine. And then one day she was like, oh no, everything's not fine.
yeah. And the point in saying that is just because someone is resistant right now doesn't mean they won't be back. And it doesn't mean that they won't talk to their friends about it, because this is why women live longer, even with all that we have on our shoulders, is because we do talk to our girlfriends and we do get it out and we do share, for the people that we're
Yes.
closest to.
And I know that's true of my patients.
I think you have quite a following, whether they're willing to share it
Yes.
publicly, but everybody is like, just has been shouting from the rooftops that I run into of, oh my gosh, Emily's changed my life. And, they just go
That's so
into,
sweet.
yeah. So even if they won't put it online, they're telling their friends
Yeah.
and closest.
And even if you're not online, the word of mouth. I mean, we both run businesses and most of our business comes from word of mouth. So it takes time, but yeah, do you need social media? Not necessarily. But things like this, we really want to put a spotlight on people who are doing the good work.
Well, and like trailblazing in the
Mhm.
industry, because there's so many people stuck in the past, but there's also so much changing, like by the minute. It's kind of like
Constant.
the era of AI, like women's health and AI, although I think AI is going to go like this, but women's health is slowly going like this. And I think, it's been in this horrible place for so long, and women's health finally, like, the door has been opened and the research is starting and like everyone's talking about it. And yes, it's probably because I'm in this phase, so I hear it even more. But I don't think 10 years ago, everyone was talking about perimenopause. I just don't think they were.
No.
So I do think it's truly changed in the certainly last 2 years, but even in the last 5 years. And then just what we've seen in 12 months has been incredible. So I can't wait to see what the next 12 to 24 months looks like for women's health in this country and around the world, because that's a whole nother topic of how underserved women outside of the U.S. are in this realm.
Yeah. And women hold the families up, and are taking care of the needs of so many people. So if they're not feeling well, it affects a whole chain of people. And it's nice to see this being, I don't know, even just women's empowerment, but all the self-care, all the options. I don't know. In some ways, it feels like the world is fighting a battle, like we're going backwards, but I have to hope that we're moving forward. And when we educate the younger generation, we do make change.
100%.
You know, I have two sons, and, you know, one is 21 and the other is 19, and they're so smart. And when I look at Instagram or the news and think the world is falling apart, they always have a unique perspective. And I have faith in the younger generation. I really do. They get a bad rap, but they're so much more open to information and less resistant, and they're more evolved. And,
Totally.
you know, I think that my job as a mother and a woman is to make sure I live my best life, because I think that's the best thing you can do for your children.
To model it.
Yes. To model it. It's not what you say. It is modeling how you live. And even, you know, my kids are eating fried food all the time now. Oh my gosh. Every time I look at,
That's all my kids will eat.
I mean,
So,
it's like, I did not raise them that way, but people always,
They'll come back.
yes, people always say that. They're like, they watched you all these years.
Right.
They'll come back around.
but you do eat like a bird. So I'm not sure that they're going to actually eat what you eat.
I'm just saying healthy choices and taking, you know, it's just, we're modeling so much for the world. And it's like, we just have to take care of ourselves. And I do have faith that it's all going to come back around. And, you know, I guess if you could kind of talk to anyone, men, women who are watching this, you're based in Denver. I don't know. I'd like for you to kind of give a plug for, you know, your business.
The Sweet Spot. I'll tell you a little bit about the name, because I think that'll kind of bring it full circle. So Le Sweden French is the sequel. It's the second coming.
Nice.
It means what happens next. Obviously, there's a play on words.
Right.
Precision medicine. I find everyone's sweet spots, right? But I sit across from women every day who say, is this it? Like, is this as good as it gets?
So sad.
I'm not well. And so, you know, in my practice, the answer to that question is this as good as it gets? Is this it? Do I have to live like this? The answer is absolutely not. You know, even if HRT scares the heck out of you and you need to get to know me, I can't tell you how many people, I've got patients that come in and I say, well, you know, how are we doing? Are you ready? No. Then it's like, okay, what are we talking about today? Right. And so I'm building the rapport, but
building trust.
Because I am there for when they're ready. You know, to the point of these people might come back.
I love that they're coming, though, to at least have the conversation.
Totally.
Because that's the step. And I do find that a lot of my friends, because we're all like mid-40s, and some of them, they're just too overwhelmed, to your point. But if they have someone that they can trust and at least start a conversation and have continual care, like that's the answer. That's what I could never find, was like someone to listen and not tell me that I just needed anti-anxiety medicine, because I was like, no, this is so much more than an SSRI or whatever it's called. And then the minute I finally got the HRT care that I needed, that I had to piecemeal together myself, like I'm literally back to my 30-year-old version of myself within the day that I got the estrogen at the right level. Like, no exaggeration, the day.
It's wild.
And I called her. I'm like, oh my gosh, ding, 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 ding. And I'm just shouting from the rooftops, like, you can feel like yourself again. So that's so cool. But I love the name. I did not know that. Of course, it's French. So,
so that's, you know, I think for, you know, if we're talking about a plug for the business is, you know, I am there for the conversation of, hey, I heard this. talk to me about this. I love white paper studies. Let me show them to you, right? In fact, here's a copy to take to your primary care physician.
Right.
It's on me. So I just love walking with people through this.
Yeah.
It's so gratifying. So, and there are times where we need to look outside of HRT.
Yeah.
Right.
And it's important to have that discerning
Yes.
gut and eye as well of, hey, I am concerned we're dealing with something else. And to have that close referral network around you.
Yes.
Because I think it would be irresponsible to say that everything is cured by that, right?
Totally.
So, I think I do a pretty good job of offering that really comprehensive view on it. And I help men and women.
Yeah, I knew that. I love that. So she can help couples too.
I get emails all the time. I'll see a new patient on the book. I look in the notes section.
So-and-so's
My
husband.
wife feels so good. I think I need to come see you too.
Yes.
Aw.
And it's like, that's it. That's the ticket. That family, those children.
Yeah.
I am the child of a woman who was denied HRT in a very extreme way. And it was incredibly disruptive. And so that is all, it just is so much broader than even the patient that sits in front of me.
So what do you generally offer to the men?
So we do testosterone replacement
Okay.
in a man who isn't still desiring fertility. If a man still desires fertility, we have a lot of other options. I do a lot of cool compounds. We work with enclomiphene. There are, supplements with sheep testicles and Chinese herbs that are really cool.
Sheep testicles.
Pound that down into a capsule, eh? But I do a lot of peptides with them, and they're very, very happy and kind of get the pep back in their step.
Yeah. Right. And I think the most important thing here is that you will be able to sit down with someone and talk to them, even if they're not ready, just to discuss options. And that's key, is like feeling like you're being heard. And I believe that people have a very good intuition. And once they feel comfortable with a provider and understand what their options are, they can make very good decisions. It's the lack of education and the misinformation that's really where we get hung up. So I think that's a really great plug, is that anyone can come to you for a consultation. Yeah.
And is it just in person here in Denver?
I am licensed in the state of Colorado, so I can do telehealth within the state of Colorado. I really think about, so as a nurse practitioner, they make it very difficult for us it's unlike a physician who can get
licensed in other states.
And I can get licensed in other states, but there's no seamless way to do it. So I would actually have to hire someone to keep track of what state needs CEs, what state is every other year, which state is every year. So I've thought about choosing a few states of, I'm from Maryland originally. That would make a ton of sense. I get a lot of requests from there. But for now, I'm licensed in Colorado.
Okay. Yeah. So you can do telehealth in person, and then do you have a team that works with you, or everyone meets with you initially?
Everyone meets with me.
And forever? Or it's
for
like
now.
Okay.
I am the practitioner.
Okay.
Yeah, I just hired my first nurse. I'm so excited.
Yeah, that's awesome.
So she's going to be helping take a little bit of the pressure away from, things like injection training for someone who's going to start peptides or start, medical weight loss. I do all of my own labs in-house, which is a real
That's amazing, because I had to go wait in those dumb lines and pay oodles of money.
I'll tell you what, people love that they get to come to my beautiful office where no one is sick.
Yeah.
You're not, the person in front of you isn't needing their COVID test.
Hey, yeah.
So she'll be helping a lot with my blood draws and things just to open me up to do more consults.
Right.
But then it's all cash pay. You do not take insurance.
Yeah.
Yes. Okay.
You can use your FSA and HSA cards, and those work well.
Yeah.
And, and I have contracted my rates I have a concierge lab. I work very closely with my compounders, and I've got pretty good volume. So my prices are
Competitive.
I don't want to be flippant. They're better than competitive.
Oh, okay.
That's great.
Yeah.
And so where can people find you online?
They can find me thehormoneguru.com, www.thehormoneguru.com.
Great.
And then I'm right at Colorado Boulevard and Louisiana. So right off of 25,
Right by.
tons of free parking at my building.
Yeah, that's awesome.
Mm-hmm. So it's as accessible as, I think it can be at this point in HRT's journey.
Right. Well, I love that you can do telehealth too
It's nice.
for people that can't come to your office
It's really
but
nice.
need help in a timely manner.
Yeah.
So
Well, Emily, this has been wonderful.
Thank you so much
Yeah.
for having me.
Thank you for being
you're
here.
awesome.
I'm
Thank you. I'm
grateful
so
for
glad we were connected.
I'm
Yeah.
so grateful for the hard work you guys are doing. This
Yeah.
is really cool. We just need rooftop shouting.
Mhm.
Yeah. Well, there's a lot of it going on now. I mean, I think people like my poor kids are like, oh, not another word of perimenopause. But, it's getting out there. I think it's very close to being common knowledge, but we're not quite there yet.
Mhm.
But I think in a
But
couple
every
years,
day there's
Yeah,
a new woman going in,
exactly.
going in,
Every-
hitting the
Turns
phase.
out,
Yeah.
no, thousands and thousands every
Thousands.
day.
Wild. It's like,
Every day.
So
Your
yeah.
heart bleeds,
I
right?
know.
I mean, your heart, it's just,
Yeah.
it's life or death.
Yeah.
In
But
my
now
opinion.
at least the resources are becoming very abundant and like people are sharing and talking more openly. And hopefully one day the shame will be, the stigma will
Yeah.
be lifted from like your patients sharing their story.
Yeah.
But I think they will.
I would.
with time.
Yeah. I've already felt it for myself.
Yeah.
Yeah,
Yeah, because you were kind of hesitant
I didn't
at
even want
first.
to talk about it.
And I was
Yeah.
like, no, but now you feel good. Like, I can understand that you didn't want to tell anyone
Yeah.
when you weren't yourself, but like, you're good.
My boyfriend even watched me put my testosterone cream on my inner thigh. No shame there.
No shame.
It's funny. Yeah, it's wild.
Yeah, I got the cream, I got the patch, I got the trush,
pills,
I
yeah,
got
the
the,
trush.
I mean, I
Yeah.
got it all.
I love
Yeah.
it.
Yeah.
I love it. There's something for everyone.
Yes, there is.
We just need a nasal spray.
I don't have a nasal spray.
Let's get you.
Is that what I need? I didn't even know I was
Let's-
missing it.
I love Selank in
Oh,
a nasal
okay.
spray for moments of anxiety.
Oh,
Kind of as
I
needed.
didn't know.
Oh, I need that.
Works similarly on neurotransmitters as a
Oh.
benzodiazepine, but without any of the
Interesting.
baggage of a benzodiazepine.
So you just like keep it in your purse?
The problem is,
Oh, it needs to be refrigerated.
yes.
Yeah.
So
So you need a mini fridge in your purse.
Your car.
plug it into the, don't mind me.
Yeah.
This is just my peptide. Yeah.
I love it.
Takes some foresight for me of like, okay, where am I at in my cycle?
Right.
Yeah.
And it's been, let's do a circle back.
Yeah,
Another
we will.
podcast on
Just
nasal
everybody
sprays.
needs to know that she has a lot of tricks up her sleeve.
Yeah.
Yeah, we need
That's
to
why
do
you need a
recap
consult.
at the bottom of our podcast of all the
Yeah,
things
yeah.
that you can offer and are
try.
Yes,
available.
Yes.
Yeah.
That's awesome.
Oh, I didn't even
It's
know.
abundant.
Yeah.
It's abundant.
Thank you so much,
Oh,
Emily.
Thank you.
Thank you.
Yeah.